This is Rick and his wife Morty. At this time, they are in their living room having lunch together. They have been married for 30 years since they were 18 years old. Rick is a combat veteran of the Persian Gulf War who got redeployed after 9/11. They have 2 kids. Rick was diagnosed with PTSD after he came home from the Persian Gulf War. He hasn't explored treatment that thoroughly. Rick and Morty have been struggling with their marriage lately due to some of his PTSD symptoms, and Morty is demanding that Rick seek treatment. PTSD is classified in the DSM-5 as an anxiety disorder. PTSD is caused by experiencing an extreme trauma, a trauma that is outside the range of usual human experience. For example, rape, war, physical attack, torture, or natural or man-made disaster. The pathophysiology of PTSD involves multiple brain structures and is associated with long-term changes in neurobiology. Brain areas involved in the stress response include the medial prefrontal cortex, the hippocampus, and the amygdala. Glucocorticoids and norepinephrine are the 2 neurohormonal systems that act on the brain's areas to modulate PTSD symptoms and memory. If cingulate activation is inhibited, a trauma can be re-experienced. This contributes to the symptom of flashbacks that PTSD survivors experience. PTSD commonly presents itself for Gulf War veterans with symptoms such as re-experiencing the trauma with intrusive thoughts and nightmares or flashbacks, avoiding others or activities they may have enjoyed before and places that remind them of the trauma, aggressive or self-destructive behavior towards themselves or those around them, an exaggerated response to a stimulus, and outbursts, sleep inconsistencies, and problems concentrating.
In the first Persian Gulf War occurring in the early 90s, over 695,000 soldiers were deployed to the Persian Gulf in Operation Desert Storm, Desert Shield. It is estimated that 10% of soldiers returning from Desert Storm, Desert Shield suffer from some form of PTSD. That means that nearly 70,000 veterans from that war alone are suffering from PTSD. In Operation Enduring Freedom, Operation Iraqi Freedom, which started in 2001, continuing to present day, over 1.9 million soldiers have been deployed to the Persian Gulf. Soldiers returning from OEF, OIF suffer from PTSD at rates of 10 to 20%, but are also documented as high as 37%. At a minimum, that would be 190,000 soldiers, but it is actually probably much higher. It is important to understand that higher percentages vary with branch of service, location, and type of combat served. In one example, close to 33% of the troops who deployed during the Gulf Wars were members of the reserves and the National Guard more than in any other recent combat operation. As a result, the men and women deployed were not as extensively trained as their fellow active duty members. They experienced longer deployments and less rest periods. Additionally, this combat environment was highly stressful and many soldiers experienced roadside bombs, IEDs, handling human remains, death, and more that increased their risk for PTSD and major depressive disorder. Another factor to consider is that many soldiers and veterans PTSD is undiagnosed or underdiagnosed. Adding to that number, 50% of those veterans with PTSD do not seek treatment for PTSD. When you add up the numbers, it means that Gulf veterans from both wars suffering from PTSD could be well over 500,000. Awareness and index of suspicion for PTSD among this population should be a priority among providers and caretakers who have contact with veterans of both Gulf Wars. Currently, and as we move into the future, it seems inevitable that there will be an increased need to recognize, diagnose, and treat the potentially high number of Gulf War veterans suffering the effects of PTSD.
You've just been super on edge lately, and it's really frustrating me, and I think that we should talk about it.
I don't think there's anything to talk about.
What do you mean? You've been extremely destructive to the family. I don't even want to be around you, and the kids don't either.
How have I been destructive at all? Honestly, give me an example.
You threw the plate against the wall last night at dinner, scared us, and we didn't even want to be around you anymore, so it ruined our dinner.
what you told me last night, I mean, why wouldn't I get that angry?
What do you mean?
You know, I've just been in my own head lately, and I really don't want to talk about it, honestly.
And I understand that, but you need to understand how this affects me and the kids. Like, I can't even explain to you how this affects me personally. I can't even sleep. You wake me up all the time screaming from your nightmares, and you won't even talk to me about it. The kids and I want to go do fun things, like go to concerts, and you can't even do that because of the loud noises. You know, we want to go to the park and all be together, but you won't even do that. You know, so it would be helpful if you could just tell us what you want to do so we could do family things together.
Well, you guys, you can go do those things, like go to the park, go to concerts.
But you don't understand. It's that we want to do it together. We don't want to just do it us three. We want to do it with you too.
I don't know. I mean, do you really need me there that bad?
Well, I don't see how you don't understand that we want to spend time with you.
We're at home together all the time. I mean,
But
isn't
you
that
really
enough?
don't even spend time with us at home. You're pretty much in your room the whole time.
I'm always here, man. Watch TV with you guys, hang out.
But that's
We
not
have dinner
quality
together.
time together.
I don't know what to tell you.
I think that, you know, we should go to therapy or do something more than this, because I don't know if I want to do this anymore then.
Like you want a divorce or something?
I hope it doesn't get to that point, but it might if
I mean,
you
you're
don't
gonna
want
throw
us to
away
help.
30 years for this?
Rick has agreed to go to treatment. They are now in the therapist's office for an initial visit.
So can you tell me what brought you guys in today?
Yeah, my husband suffers from PTSD from when he was in the war, and it's just gotten too bad at home, and I can't deal with it anymore, and this is kind of like my last straw, and I was hoping that, you know, maybe this therapy would help us, so that's why we're here.
Yeah, that's definitely the goal. Rick, can you tell me some symptoms that you're experiencing?
Well, I mean, you can ask her about most of them, but I've been having a lot of nightmares almost every night.
Mm-hmm.
I mean, everyone tells me I wake everybody up.
Especially me.
Yeah, that must be hard.
Flashbacks a lot of times during the day. I don't even know what really triggers them. I mean, it's just, and then I'll start yelling randomly at my wife or my kids, and it just escalates from there. And a lot of anxiety too. Like I don't really like to go anywhere. Or I mean, they like to go to concerts and go out on the town, whatever. And I can't do any of those things.
Okay.
So
Yeah. So it seems like this has affected your life a lot.
yeah, pretty much every day.
Yeah.
Do you and the kids too, a lot.
Yeah. Yeah. Do you feel like you have a good support system?
I feel pretty alone actually. I mean, I don't know how to talk to my wife or my kids about it or anything. I mean, I know they want to help me. I mean, that's why we're here.
Yeah.
But I don't know. I don't have any friends.
Okay.
I had a few buddies from the war, but we just
You
lost contact.
yeah.
And I don't know. It's just at this point, I don't feel like anyone really understands me. I mean, I don't even really understand what's going on.
It's frustrating though because he won't even talk to me about it. He just yells at me for it.
Yeah.
So I feel like I can't do anything to help him.
Well, that's where most of my anxiety comes in. I mean, she starts asking me, and I don't know what to say. Like, I don't even understand it. I want to talk about it. So.
Well, this seems like a really hard time for both of you. And Morty, if you're okay with it, I would like to have a one-on-one conversation with Rick.
Yeah, I just wanted to know if you could possibly talk to him about like the treatment options or something that we can do about this, because it's gotten too far and I can't do this anymore. And anything that you think would help, like medications or group therapy, I'm willing to do anything.
Yeah, we have options and we'll definitely discuss that.
Okay.
Yeah, Rick, are you comfortable talking just me and you?
Yeah.
Okay.
Thank God she's gone. I swear she's causing half of my problems.
I heard that. Okay, seems like, okay, now that we're
Oh, there you
gone,
go. Yeah.
I know this is a really hard time for you guys, but I do think she just wants what's best for you, and I think just clear communication between the two of you is going to be what's best.
I need to start communicating.
Yeah.
at least.
Well, I can assure you that you're not alone. There are various treatment options available, such as pharmaceuticals, as well as therapy modalities.
Okay. We might as well start trying because we're not getting anywhere. on
Great.
them,
Well,
so,
I'm glad you're willing.
yeah, thanks.
When it comes to PTSD, treatment means a reduction in symptoms, both PTSD symptoms and depression symptoms. There are a few treatments approved for PTSD. As far as medications go, there are 2 antidepressants that fall under the category of SSRIs, sertraline and paroxetine, that are approved for the use in the treatment of PTSD. There are also various forms of therapy that are used to treat PTSD. The 2 therapies that are currently first-line treatment with an up to 80% success rate are cognitive processing therapy and prolonged exposure therapy. What are cognitive processing therapy and prolonged exposure therapy? Cognitive processing therapy is based around goals that allow the patient to recognize and then manage thoughts that are related to their trauma. The clinician aids the client in changing the relationship between their thoughts and feelings and to identify what thoughts are due to their trauma. Ultimately, the client is working to replace negative thoughts with more accurate thoughts and develop coping mechanisms for their emotional responses to increase their sense of safety, power, and control. Prolonged exposure therapy is a therapy that is based around creating a safe place to confront their traumatic event and invoke the feelings and senses that surround that event, while being provided ways to work through it. This is repeated until the event no longer holds the power it used to. These treatments are done short-term, in an 8 to 12-week time span. One study examined cognitive processing therapy in a group versus individual setting, and results showed that patients in individual cognitive processing therapy had a greater reduction in PTSD and depression symptoms. Caucasian patients also experienced a greater reduction in symptoms when compared to African American patients. This may indicate that this particular therapy modality is not currently culturally competent. Another study compared combined treatment of prolonged exposure therapy in addition to the use of an SSRI, sertraline, and treatment with therapy and SSRI use alone. Results showed that combined treatment was no more effective than either of the treatments alone over the span of 6 months.
That's one of my biggest pet peeves is when people try and cut this with a butter knife.
I don't understand why you're judging me for cutting with a butter knife.
I don't
It
know.
worked
I've just
perfectly
seen,
fine when I cut the
I've
other
seen
part of the
so
avocado.
many people cut their hands doing that.
With a butter knife?
Yes.
No.
Because you put it